So if someone says to me, Chuck, describe the ideal instrument to remove submucosal fibroids, what would you say? Well, the first thing I would say is we need to use an ionic solution to distend the endometrium. I would also like an instrument that allows mechanical removal of the fibroid rather than using energy. On the other hand, as someone who does a lot of removal of submucosal fibroids in patients who are interested in future fertility, I'm always concerned about tissue destruction. The other aspect of my ideal instrument would be that it would be side working. The risk of perforation is increased when we are utilizing a front working instrument, decreased with a side working instrument.
I'm impressed the most by the procedure's ability to extract all of the fragments, so I have a complete pathologic specimen. I'm also impressed by the speed at which it operates and the safety profile. The size of the instrument also is very important, especially when you're choosing something for an office setting, or even in a setting where you may not want to dilate the cervix very much, like in patients with infertility. I have yet to have to dilate a patient with this instrument. The Myosure procedure gives me a non-electrical, mechanical way to remove those tumors in a safe and speedy manner.
I chose to have the Myosure procedure because it was offered to me in February of 2010 as a new way of taking care of the uterine fibroids that I was experiencing, which included abnormal bleeding and, in my case, quite a bit of spotting, which, as many women would understand, is a large annoyance. When I had my initial appointment with the doctor, and I'm like, I think there's something the matter, we got to look at this. I said, well, I want anything like abnormal out of my body. So I had in my brain that I had these fibroids there and I wanted them out. So thank goodness, I'm telling you, thank goodness this came along. So, and to your point, if things reoccur, because that's what can happen with fibroids depending on where they were, I've learned as I did some research and through discussions with people, I would go back and do this procedure again because of the fact that it was non-invasive and I went home with my day. So the fact that I would have had the option then to either continue to deal with what I was dealing with or eventually look at the option of a hysterectomy. And the fact of the matter is, I know from many friends and family members, or not many, but friends and families members who have had to go through hysterectomies, that there is a longer recovery period for that and definitely would interfere with your schedule for some time, and that really wasn't in the cards for me at this particular point, or really honestly of interest. So again, the Myosure procedure was very quick, very painless, and I was right back to my daily activities.
The Myosure procedure fits into my practice as a gynecologic surgeon by giving me another option in the treatment of patients who have submucosal myomas. The procedure offers an opportunity to do definitive resection in either an office setting, which I have done, or in the surgical suites. The advantage of this procedure is that it has a very small blade with minimal or no dilation. And in my infertility patients and in some of my, certainly in my postmenopausal patients, that's very important.
So if you say to me, Chuck, put together that ideal instrument to treat submucosal fibroids. Number one, has to be ionic solution. Number two, it's mechanical. Number three, you evacuate the chips. Number four, it's a small instrument that can go up right through the cervix with ease and allows us to do it in office.